Welcome, everybody. Lovely to see you all here. We've got a very nice group, a size of 24 or so. Some people who were in my earlier session have had enough guts to come back for another one. Nice to see Carrie there and Roger. So I'm going to be talking about ecological economics and public health. And I'm going to present some stuff and then we'll have a discussion. And I think as we managed last time, we have 24 participants here. We'll do the same thing, which is either, once I've done, wave your hand at me or put your hand up in the little hand box thing. And when we get into that, and then people can speak. There's Paola has joined us. Lovely, Paola, how are you?
I'm doing okay. Unfortunately, I can't stay for the whole time, but I'm happy to be here for this part.
Nice, great. Okay, so I am going to go to share screen and hopefully this is going to work because, yeah, that whiteboard option is very odd. But anyway, can people see that? Yes, good. And a thumbs up from Kathy. So I'm going to go to full screen here. So I want to talk about ecological economics because one of the areas where we need some of the greatest change is in our economic system. And you heard the phrase earlier about being fit for purpose, and I'm going to argue that our current economic system is not fit for purpose in the 21st century, and that we need a very different economic system, one that is designed to be fit for purpose, given our ecological and social injustices that we face and the massive and rapid changes we've been discussing. And so one of those key transformational challenges is how do we challenge and how do we transform ecological economics or our economic system. So just to remind you, I'm going to take it a little bit longer than 5 to 7 minutes, but then we do have that extra 5 minutes at the end, which is kind of nice. So I might use that opportunity, and then we'll have. It's not really. It just really is basically 30 minutes for discussion, and we'll see where that takes us. So what I'm going to say is based in large part, on a piece that I just completed and was published 2 months ago now. By the National Collaborating Centre on Healthy Public Policy. And it somewhat follows up on an initiative from 2 or 3 years ago when Canadian Public Health Association conference was held in Montreal. And I was in discussion with some folks at the Quebec Public Health Association, who are the provincial hosts and the conference hosts. And the executive director there really wanted to do something around ecological economics. And I suggested inviting a friend of mine, Dan O'Neill from Leeds University, but originally from here in Victoria, to talk about ecological economics, which he did. And that piqued the interest of the National Collaborating Centre on Healthy Public Policy, which is based in Quebec. And so they asked me to do a paper, and eventually they published it in the form of an interview. It's not really an interview, it's my original paper then split up into interview type format. Here is the table of contents for that, and you can get to this online very easily. And I talked about some of the things I talked about this morning, the ecological determinants and the Anthropocene, but then talked about the stuff that I'm going to focus on this afternoon, which is ecological economics, alternative models, making the transition and the role of public health. This is not exactly a new idea. This was one of my mentors from more than 40 years ago now, Peter Draper, who was a public health physician like myself and died actually about 10, 15 years ago. But he set up something called the Unit for the Study of Health Policy at Guy's Hospital in London. And this was a paper in the Royal Society of Health Journal back in 1977 about health and wealth, and has some of the same ideas that I'm talking about. Relatively soon after that, this was something called the Other Economic Summit. So back in the 80s, there was a group of alternative economists and sort of ecological economists and others looking for societal change. And they started holding a series of parallel conferences to the annual World Economic Summits, which then were what we today call the G7, would meet, their finance ministers would meet once a year. And that was called the Economic Summit. And so they created the other Economic Summit and held it in parallel. And I actually contributed a paper to this particular conference in 1985, which was focused on health, wealth, and the new economics. So again, not really a new idea. It's been around 35, 40 years or more, but never really gained much traction, and particularly in the realm of public health. So here's what I'm going to cover in the next few minutes, and I'm going to cover it very quickly. You can read some of those materials, particularly my recent report for the NCC, to get more on this. I'm going to talk about the fact that there's actually not just one form of capital, but multiple forms of capital. And that what we have today is what I would call fake capitalism. Why growth is a bad idea, why GDP is a bad indicator, why we need to dethrone the economy from being the center of all our decision making. And then to discuss a little bit about what is an economics that would be fit for purpose in the 21st century. So here's an important place to begin. This was the Worldwide Fund for Nature. In every 2 years, they come out with a Living Planet report, which tracks the ecological footprint and tracks the Living Planet Index, which were the two key indicators I used this morning in that set of 4 global indicators. But they said this: ecosystems sustain societies that create economies. It does not work the other way around. So a key point here, for example, is we need to stop thinking that somehow the economic domain is the most important. The economy is simply a social construct. It doesn't have some sort of God-given independent existence. We create an economy. We put parameters around the economy. Our values drive the economy and our decisions around it. Those are all social decisions. And so the economy is actually a subset of the social domain. And we need to really get that into our heads. It's our economy. We can do what the hell we like with it, in effect. We certainly construct it, we can reconstruct it, deconstruct it, whatever. But then all of that exists within the ecological domain, and it is the ecosystems that sustain us. It's not that we can't use the economy to generate oxygen or water or food. We have to use the resources that are there and then figure out how to use them effectively for our benefits and the benefits of other generations and other species. There's also this notion that's really important about capital. So we talk about capitalism, but capitalism as we currently practice it is focused on the red circle. It's focused on these two notions of manufactured capital, so stuff, whether it's this mug that I'm holding out or the house that I'm sitting in or the urban built form all around me. But that's manufactured capital. And then financial capital, which is the flows of what is really a kind of polite fiction called finance, called money around the world and around our communities. But all of that is only one form of capital, really. I would call it economic capital. Then there are ideas of social and human capital. And then there are ideas of natural capital. And our problem is that we are sort of economically blind. We only see one form of capital. We see the red circle. We neglect notions of social capital and human capital and natural capital. We don't even build them in to our economic models. And if you read into the literature, you'll realize that those kind of forms of capital are actually considered externalities. They're not built into financial or economic models. They don't count. So the fact that you make money by impoverishing a community over here or destroying a resource over there doesn't show up in the balance book. And so often in our current system, we build manufactured capital and financial capital while damaging social capital or human capital or natural capital, which is the earth and its resources and other species. And so for me, the form of capitalism that we practice is actually fake capital. And let me just see. Yeah, so we're only growing one form of capital while depleting the others. What if our purpose instead was to be real capitalists, to actually build all four forms of capital, that is to say, economic, social, human, and natural, all at the same time? So when I get a chance to talk to businesses, which isn't very often because they really don't want to hear this, I argue that they're not real capitalists, that they're not practicing real capitalism, that a real capitalist would grow all four forms of capital at the same time. And if you're not doing that, you're a fake capitalist. So we need to be rethinking what it means. And I would argue that from the point of view of an economics fit for the purpose in the 21st century, the thing we most want to grow is human and social and natural capital. And then we devise an economic system that does that and, yes, makes some money at the same time, or at least doesn't lose it, I guess. But that's not the primary purpose. It's not about the economy. It's about all. The economy is a means to an end. It shouldn't be the end, but it has become the end. It has become central to government, to purpose. Another really key point is endless growth on a finite planet is just not physically possible. So here is an usual desire for a growth rate of around 3.5% annually. That means the doubling time is 20 years. So in an 80-year lifespan, which is what most of us expect we will have, our economy, if it grew at 3.5% annually, would be 16 times larger in 80 years' time as it is today when we start counting. And really, seriously, we can have an economy 16 times bigger? I doubt it. Kenneth Boulding, and this was way back in about 1973, he was former president of the American Economic Association and the American Association for the Advancement of Science. Anyone who believes exponential growth can go on forever in a finite world is either a madman or an economist. Thirdly, GDP. So we measure progress using GDP. It was never meant to be used to measure progress. And in fact, one of its key architects back in the 30s warned the US Congress that it shouldn't be used that way. The welfare of a nation, he said to the Congress, can scarcely be inferred from a measure of national income, which is what the GDP is. So we measure the wrong sort of progress. And so, for example, one good way to increase GDP is to grow and sell more tobacco. And not only do you grow the economy from growing and selling tobacco, but the really good news is you make a lot of people sick, so that you then have to grow a healthcare system to treat them all, and that also adds to GDP. Well, is that progress? Is harming health or harming the environment or harming communities progress? The way we measure it, yes, it is, which is dumb, just plain dumb. And that's what I just said, so I'm not going to repeat all of that. The other point is, though, that what the GDP excludes is a whole bunch of other things that are good for us. So when you volunteer, when you care for your family or your neighbors, when you do any kind of unpaid community contribution work, none of that gets measured in GDP. So not only does it include a lot of harm, it excludes a lot of good. So people are looking at alternatives such as the genuine progress indicator. So the key question here is, what would be an economics fit for purpose in the 21st century? What sort of economy could achieve the goal from our perspective of achieving good health for all and a good quality of life for all while living within the constraints of this one small planet? And so this is a quote I used earlier. Our current system seems perfectly designed to heighten inequality and harm the natural ecosystems, so we need a different kind of economic system, because this one is not working. It's giving us the results it's designed to get, but they aren't the results that we actually want. So Herman Daly, back in, who's one of the key leaders of this sort of thinking for 40 years or 50 years now, enough, he said, should be the central concept in economics. Enough means sufficient for a good life. So away with excess. Here's a couple of ways to think about it. This is the notion of a steady state economy, which is something that Herman Daly has been one of the great champions of. The bottom there, you'll see Dietz and O'Neill, that is Dan O'Neill that I mentioned earlier. An economy where resource use is stabilized within environmental limits and the goal of increasing GDP is replaced by the goal of improving human well-being. It's an economy where the goal is better lives, not more stuff. So if this is the kind of economy we want, we're going to have to rethink the economy. And here's one final example. I think this is my final slide just about. The notion that's come from, somehow the name got lost off there, but it's Kate Raworth. Kate Raworth, her notion of donut economics. So we need an economy, the inner dark ring is the social foundation. You need an economy that is big enough that everyone can have all of the social determinants that are at the center there: water, food, health, education, at adequate levels. But it mustn't be so big, which is the outer dark green circle, that it starts to create climate change or ocean acidification or chemical pollution or all those other bad things. So what she talks about is we need an economy that's in that donut. It's big enough to meet everyone's needs, but small enough that it doesn't harm the planet. And she calls that a safe and just space for humanity, and so on. So these are some of the alternative models that we're thinking about. And I'm going to just skip over that. So what are some of the implications for public health? And this comes out of my report for the NCC. Endorse the concept of ecological economics. We need to do that. We need to say the current system doesn't work. We need a different model, folks. We need to advocate both within government and communities to develop an economy like the donut economy. We need to partner with ecological economists. How many of you, I wonder, know an ecological economist or have done much thinking or reading about this? We need to get informed. We need to find these people and work with them and to explore, among other things, the health impacts of the current economy and an alternative economy, which would be a healthier economy. We need to work with partners across all sectors, look at things like the health co-benefits of active transportation. What are the health equity implications of sustainable policies and practices? Not all of which are good. Some of them might be bad. We need to think about that. And we need to support locally the development of local businesses that are trying to create the sort of economy we need, the sort of socially just, we talk about the transition, the just transition. It's all part of this. So I will leave it at that and throw it open to you folks for comments, thoughts, discussion, and I will cede the screen so that Kathy can take some notes as we go along. So anyone, thoughts, ideas, questions, comments? Roger, you got your hand up there.
Yes, I do, Trevor, and you can imagine I'd want to jump in on this conversation.
I thought you might.
Yeah,
you probably tell people why.
I used to be working within the realm of public health, and I'm now a professor in the School of Business at Okanagan College. So I act almost like a translator between the conversations, the paradigms, the thinking processes of both. And so it comes to a point when I teach sustainable management class that I wrote and have taught regularly for the past 4 years. And so one thing I wanted to bring to your attention, Trevor, is just this idea of the humongous chasm between our current understanding of economy and our current language about economics, and then the new paradigm that you're talking about as being a humongous leap and something that's very, very scary to attempt. And I'm wondering if taking some measured steps in that direction might be a good idea. And the thing that always amazes me, having spent lots of time in the health world, is when we talk about economics, if you're to think about the environmental piece, For a long time, it was really difficult to talk about what's the value of a green field, what's the value of a stream, what's the value of a lake, a forest, whatever. And one of the ways that people were, if you look at environmental economists, what they were basically saying is, well, if we can't put a price tag, if we can't put a value on let's say a stream or a forest, then we can at least do some kind of surrogate market or hedonic pricing. So basically, well, what were the property values before this, when things were pristine and beautiful and healthy, and what are the property values now that they've been destroyed? So the forest is gone, the river's polluted, whatever. And that was one of the methods that they were using to try and value economically something in the environment, is the change in manufactured environment, just like you were talking about that trade-out. So what I'm wondering is why it is that governments will choose to intervene if there's environmental damage caused by, let's say, the private sector, but there's very specific fines for certain kinds of egregious violations. But what you don't see is governments intervening when you talk about the human or the social capital of the different capitals. And so there are very few disincentive systems in place when companies will displace populations, when companies will cause individuals in the local community harm, directly or indirectly. The only place I can see it is if you talk about WorkSafe or workers' compensation, and if somebody gets harmed in the process of actually doing a job. So I guess what I'd like to basically say is public health could help to move in this direction if we could help try identify the costs, the human costs of some commerce decisions, just like the environmentalists have identified the environmental costs of company actions.
I think that's exactly what we need to do, both in terms of health impact analysis, which is still, so governments do social impact analysis sometimes, they always do economic impact analysis. I think it speaks to a much deeper issue about what is the primary value, what is it we value most? Do we value profit and money most, or do we value people and planet most? If we value profit and money most, then we will discount harm to the people, harm to the planet, because a life's only worth this much, but we could make this much money. So that's the trade-off. The problem is the people who make the money aren't the people who lose their lives. So there's that sort of deep aspect to it, I think. There's also, we do and have tried to develop the notion of health impact analyses. It hasn't really caught on, but we need to keep pushing it. There's some work done. We need to expand that and embrace the notion of comprehensive impact analysis. So policies should be subjected to analyses of their economic, social, environmental, and human development impacts, and that should be accreted. There are approaches that some of you may come across, particularly around the West Coast here. There's a program or an approach called Municipal Natural Assets Inventory, which puts a value on forests, on natural streams, on things like that, as part of the municipality's set of assets that enable it to better manage its environment. And so those are some of the things, but I see Paula wanted to say something, and I know that she also, like you, teaches in business as well as health. And before she goes, if she does have to go, Paula.
Thank you. I have to go at 2, unfortunately. Love to continue. But one of the things I've been thinking a lot about is that a solution to put forward to our public health community is really around ensuring that we are having opportunities for interdisciplinary teaching and learning, so that we can actually start looking at the intersectoral solutions that we need in practice. So I think that a lot of sectors are thinking, I've been doing a lot of work over the last few years with the sustainability community in Surrey specifically. And so these conversations are happening all the time because people are coming in from different disciplines. So I think that the public health capacity building needs to change. It needs to really needs some innovation in terms of bringing these conversations so that as we are preparing our future leaders, that this is not something that we're listening for the first time, but it's actually something that's integrated, woven into our programs. That's one thing I wanted to say. The other thing is that I really appreciate the issue around how do we support building the local economies. And I think that one of the things I'm really passionate about is the co-ops and the cooperative movement across Canada and around the world, because what I think is the possibility there is actually living and breathing the health promotion principles that we have around empowerment and participatory approaches, because when we come together and build co-ops, it's like we have to come from the perspectives that we are all equal. We're bringing a vision together. We're building something together. And that, I think, is really important right now, also in the context of the conversations that are happening around racism and how to provide Black, Indigenous, and people of color opportunities to own business, to be a part of business development. And so I would really, kind of encourage us also to be thinking about that as another possibility in our public health community of looking for these alternative models that actually aren't alternative at all, and people have been using them for a long, long time. But how do we as public health practitioners immerse ourselves in these organizations, associations, and people that have been doing this work for decades? And I think that there is a lot of hope. I'm always eternal optimist, I think that there's a lot of hope for our future generations to be doing this kind of work. And just to say thank you so much for bringing these conversations, Trevor, to this community. Roger, we're so happy that we have people like you in our community that can bring those different lenses. Anyway, I really look forward to seeing particularly more Black, Indigenous, and people of color stepping in and having these conversations amongst the public health community. And unfortunately, I do have to run because I have another meeting at 2, but I have like 2 more minutes to stay on.
Good to see you. Couple of things. Kathy, do you mind sharing your file for the Word file, if that's what you're using, so that we can actually see your notes as they go along? It'll help people
Definitely
gather thoughts.
Sure.
Couple of quick thoughts, Paola. Those of you who know me know that I write a weekly column for the Times Colonist, and the one I wrote this week that just went in yesterday and will be published Sunday is actually very much about this. It wasn't intentional, but it is. So one of the things I'm talking about there, co-op is a piece of it, but the notion of import replacement. So we import a lot of food and a lot of energy to Vancouver Island, all of our fossil fuel, most of our electricity, 97% of our food. How much of that could we grow locally, which builds the local economy and builds community? So there's a whole body of work around from the Centre for Local Prosperity in Atlantic Canada looked at this for the Atlantic provinces. There's also a notion out there of social procurement, and there is something called the Coastal Communities Social Procurement Initiative that's been started here on the island. And it's municipal governments looking at how they can use their procurement policies and their procurement practices to do some of what we're talking about, to buy locally, to privilege certain communities in their purchasing, to purchase in ways that build or protect the environment, the green purchasing, things like that. So yeah, there's a lot of different ways we could do that.
Okay.
So those are the same sort of ideas that I think you're talking about, Paola.
Thanks so much. Sorry, I have to run.
Okay.
We'll look forward to continuing the conversation.
You bet. I see Karen has her hand up. That's Karen Sawonka. We can't hear you. You're muted. Oh, I'm not seeing any audio there. So, Karen, maybe you have something in the chat box. If not, maybe you can put it there. I see Michael Keeling just made a note there. Michael Keeling is with the NCC on Healthy Public Policy and was the person I work with in bringing that sort of book on ecological economics and public health to fruition. Hi, Michael. Nice to see you and hear you there. Or see you anyway. Haven't heard you yet. Okay, well, you may be phoning in, Karen, but we're not hearing it. So I guess if you've got a comment or question, it'll have to go into the chat box. I don't know why that is, but no microphone is showing up and we're not hearing you on the phone. Other thoughts or comments from folks?
Trevor, hi, it's Anne.
Hi, Anne.
Hi, just maybe a comment and a quick question. So thank you for that overview. That was really informative, and certainly I'll be checking out the NCC publication you mentioned. I guess my question builds on sort of the last comment around, things that we can do, different perspectives. I'm coming from it from a citizen perspective, and so wondered, and you started talking about it. Wondered if you've seen where things have worked well. Or either across Canada or internationally, of where the ecological economics has worked well, and certainly from both as an individual as well. So we'd love to hear your thoughts on that.
Yeah, I think that, well, one thing I do think is that largely this is going to have to happen from the bottom up. That I don't think we're going to persuade the government or the Minister of Finance or whatever to suddenly overthrow everything. Having said which, check out what's happening in New Zealand. Very interesting, because in New Zealand, last year, they actually brought in a well-being budget. So they're starting to frame their budget in terms of well-being instead of financial purposes only. So they're looking at equity, they're looking at the environment. It's a very interesting place, New Zealand, these days. They've got that going on. As you saw, they handled COVID very well. The government responded, and the Prime Minister there, who's very impressive, responded very well to that dreadful shooting at the mosque in Christchurch, or wherever it was. But also they've got a very strong Maori community there, and they've actually given rights to nature. So there's rivers and there are lands that have been recognized as persons with all the rights of persons. So they've given rights to nature in New Zealand. So keep your eye on New Zealand. There are interesting things happening there. Certainly, as Paola said, local co-ops that circulate the money, local credit unions for that matter. Some of those social procurement activities I'm talking about, if you look at the report from the Centre for Local Prosperity, which is based in Atlantic Canada, they list a number of examples there, a number of which are based around energy, so local energy. So and particularly, it's not such a big issue here because 90% of our electricity in BC is hydro already. But certainly in Atlantic Canada, where they import a lot of energy, looking at how communities can become more energy self-sufficient. And in doing so, it generates local work. And it's clean energy. I'll give you a wonderful example that I heard years ago now in Liverpool, where they had a public housing estate, which was not very well built in the 50s, and it was always damp. And the actual original problem they had was a lot of respiratory disease in kids because they were living in damp, moldy housing. So they decided to do an energy upgrade, but they didn't do what they normally would have done. This is an example of the social procurement I'm talking about too. So they didn't contract with some big company from London to come up and fix it all. They created a local planning committee and a local community economic development company They hired and trained local people because a lot of the people who lived there were unemployed, and they did the work. So you created community togetherness, you created local economy, they created some local businesses, they gave people skills training, and they improved the energy efficiency, which reduced the environmental impact, less energy being used, less greenhouse gases and all the rest of it. I don't think in the end they even looked at whether it improved respiratory disease in kids, because there's all those other benefits that came from it. So that's the kind of thinking. Now that was, I saw that, I went to that community because they won an award, which I had the good fortune to be able to present them. But it's a wonderful example of the sort of thing I'm talking about. Community gardens is another really good example. You look at all the benefits that come from community gardens, the social benefits, the environmental benefits, the health benefits, maybe even the economic benefits. But again, you're building all four forms of capital. So those are the kind of things that we in public health need to be supporting. Why aren't we supporting, or maybe we are, local renewable energy systems that are built locally and managed locally?
Thank you.
Now I've got Karen's comment here. So, well, I guess I just did that, Karen, as it happens. The healthy communities experience. Yes, that story just covered that nicely. So I'll move on. Is this from, who's MI? Or ML? Yes. Yeah, again, I mean, it would be interesting to do a cost-benefit analysis of public health itself if it comes to that. You know, I mean, again, we have this sort of crazy notion. The best disease to have is the one you don't get, if you like. But that's never valued. So we value churning the beds, not being empty beds. Empty beds are bad news for health authorities. They should be good news if they're empty because no one's getting sick. Other thoughts or comments? How are we for time? Let me think. Oh, we've got about 10 minutes, 11 minutes. So one of the things we should try to think about in the next few minutes is what are some key points or messages or ideas that, because we want to take back, if you saw this morning, the 3 to 5 points that Kathy is going to put into a slide for us. So either through the chat box or by raising your hand or just by speaking out, because we're only 24 people, we can do that. Let us know what you think are some key points emerging from this discussion. Just a quick point about, there's a reference here to neoliberalism and neoliberal government in Alberta, and the same in Ontario. Actually, my column the week before this one was about why neoliberalism is a really major threat to health, or has caused immense health damage. So you might want to check my column for some thoughts around that. But I think part of what we have to do, for example, in Alberta, so there is a group in Alberta, I think it may be called Earth and Steel or something like that. Maybe whoever's in Alberta can tell me. It's Carrie who's in Alberta there. I can't remember now, but it's come out of the energy workers' unions. And what they're looking at is really the just transition. So they're saying, let's not fight to the death to preserve these jobs. Let's think about what's the next economy. And so I think part of what you have to do in places like Alberta and Ontario is hold them up to ridicule. So the example I gave earlier, you know, in building more fossil fuel is like building more tobacco plants. You know, it doesn't do, and you can make some nice analogies between fossil fuels and tobacco. And say, kind of craziness is, look at the harm this does. This isn't this is old-fashioned economics. You need to be in the 21st century, not back in the 19th century. So a certain amount of that sort of ridicule, if you can, but also finding your allies. So there are allies such as that group I just mentioned. I can't remember their name. I think it's Earth and Steel or something like that. I could get it for you if you want it. But it's union workers looking at training people for the transition jobs. Because the other thing is, a lot of the alternative energy technologies create a lot of new jobs and a lot of new economic opportunities, and they're local and dispersed. So, sorry, quick points about things we might want to include in the summary that Kathy's putting together, because there's a bit too much there for her to report all of that back. Or one of us, whoever it's going to be. Roger, is your hand up again, or is that from before?
It is again, Trevor. Just I thought maybe I could add one more quick point. That if we're to think about changing economics, we have to change the conversation about economics. And one of the things that I find intensely frustrating is that if I'm a publicly traded company, I'm required to provide financial reporting on an annual basis. And there are very clear expectations for what's contained within the report, very standardized methods for reporting on finances. And if you're reporting on sustainability, which includes the human, social, and the ecological or environmental pieces, that's done voluntarily. And there are some global standards for sustainability reporting, which includes all three bottom lines. But there's nothing that's required. And so I actually think it would be a great thing for public health leaders to advocate for what businesses are held to account for with respect to reporting alone, because if you don't measure it, if you're not held accountable to it, you're certainly not going to manage it that way. And so I think there'd be a lot of value in increased pressure, and this again would be directed at the government to intervene and change legislation and requirements for triple bottom line reporting instead of just a single bottom line. That could go a long way to changing behaviors.
Okay, so one thing is to change the conversation, and one way to do that is to require triple bottom line. I would actually say quadruple.
Sure. Yeah.
Human and social capital are actually quite different from each other. We tend to lump them together. Somebody once wisely said, I can't remember his name for the moment, human capital is invested in the individual. Social capital is about the capital that comes from our relating to each other. So it's in that relationship that you have the wealth. And Robert Putnam's work on social capital in Italy was all about that, the sort of horizontal thing. There's another key, so that's one is, I would say, Kathy, is to say, shift the conversation on what is economics, and one way to do that may be through requiring quadruple bottom line reporting. There's also a point from Sabrina in the chat box. The point about not relying on government to lead these changes is key. So she's talking about the strength of First Nations communities, and I think just generally the notion of both of indigenous economic development and local economic development, community economic development, are key ideas. Carrie has a point there about finding a way to communicate the value of natural resources and social capital. I think you could put that under probably under dethrone economic capital, or as a piece of that. Does that make sense to people? We just got the 5-minute warning from Christina. So we're okay, we're doing well. Other thoughts? Feel free to speak, use the chat box, put your hand up, whatever.
Hi, it's Kemi. If I may jump in, I really like your quote, or if I may paraphrase it, that enough should be the notion of our economy and not always with excess.
Yes.
Now, for me, it begs the question, because you did say that change will come from the grassroots, but I think that there is a role for the wealthy to play.
Yes.
Reason being, you'll find in many developing countries that maybe through micro borrowing or through initiatives that were put in place to help people from maybe the grassroots level to rise up in social well-being, whereby you notice many of those developing countries or developing patches, even in developed countries, benefit from the social, human, and ecological well-being to start with, and then gradually builds the economic capital of things, whereby it's the last to kind of catch up. But as the trend continues to be that once the economic element is in place for many of these areas, you tend to see that for whatever reason, the economic drive takes over. Now, is it a thing now that at the end of the day, how do we, because I find many of the ideas that are being transferred or being imbibed by many of us comes from somewhere. There is that attractiveness of being wealthy or having access to that which you think is the ideal or is the dream. Now, where the wealthy people I think have got a role to play is how do we, in this case, dial down on the excess of what we think is a dream, and how do we push that message of this is enough. And at that point, the question is, who determines what is enough? What does enough look like? Because now you see many developing countries, even though we're saying global warming and all of that, the question is, oh, you've got all of that, now you're shouting global warming our end. How does that work? So just to kind of get your thought on the different elements of debate going on around having a balance between the four critical elements that you've mentioned to kind of have that holistic sense of capitalism and not just have the economic portion always be the loudest in the bunch.
I think that's absolutely key. Kathy, what I'd put down there is something along the lines of how do we shift from having more stuff being the goal to this notion of enough. And I mean, I think to some extent, again, to go back to what Tad was saying in the opening session this afternoon, there is this sense. I heard a lot of people for the first few weeks or months of COVID talking about, well, isn't it nice that you can see the mountains in India, or you can breathe the air in Beijing, or whatever. People begin to appreciate that there is more to life than just having more stuff, and particularly if more stuff just brings more harm. Go back to that quote about anyone who believes that you can keep growing on a finite planet is mad or an economist. But I think you're right. We need a sort of community-wide conversation, and I'll talk a bit about conversations tomorrow, but a community-wide conversation about what does constitute enough. And what, for the corollary of that is, if you go back to the donut economics, you have to have a big enough economy, but you also, the other thing about it is, if the pie is growing, you can hold out hope to people who don't have much that they'll have more because the pie is growing. If the pie is fixed, then the only way they're going to have enough is for some of us to have less so they can have more. And that's a critical discussion to have. We've got a timer going down there now for 45 seconds. So does that capture it, Kemi?
Yes, thank you. It's definitely a discussion that needs to be had, and it's very, very interesting.
So
thanks for that.
People might like to have a quick look at what Kathy's written there and see if there's anything else you want to add to that. Do we have anyone who'd like to report this back for us? Any volunteers? Got 17 seconds. Anne, how about you?
I can certainly try.
Why don't you try?
Okay.
I've spoken
Thanks,
enough
Anne.
today. Unless Kathy wants